Assalamualaikum and hi everyone. Today our group is going to present about poverty. So, what is poverty? Poverty means not having enough money to support one basic needs and way of life. There are many different factors such as social, economic and political factors that can lead to or result from poverty. Based on the articles that we have chosen and studied, the following is an overview of the point of the article. In Malaysia, income levels are categorized as B40, M40 and T20, with B40 representing the bottom 40%, M40 representing the middle 40% and T20 representing the top 20%. Then, the statistics stated in the article show a percentage of B40 household in urban areas. Next, in terms of conceptualism, Marx and Engels' political economic theory focus on the interplay of political and economic forces in society driving urban activity. It argues that capitalism dominates modern urban industrial communities, establishing causal relationships between macroeconomic trends and local social problems.
From conflict theory, political economy, derived from Marx and Engels, refers to the interplay of political and economic forces in society and driving urban activity. Central themes include social conflict and capitalism's dominant power system in modern urban industrial communities, as seen in works by Henry Lefebvre, David Gordon, Michael Stopper and David Walker, Manuel Castells, David Harvey and Alan Scott. However, Marx and Engels argue that capitalism profit motives lead to class struggles and economic inequality, affecting the current high living costs and wealth gap and highlighting the unequal distribution of resources within a capitalist system. Moreover, capitalism exacerbates inequality for single mothers, leading to low wages and limited job opportunities. Thus, Marx and Engels link macroeconomic trends with micro-sociological issues within local communities, and the global economy is controlling city communities today.
I will explain on the factors that influence poverty. There are a few factors that influence poverty. Firstly is high cost of living. The article highlights respondents in the urban area who admitted and agreed that the cost of living is increasing, particularly for families with multiple families, as the minimum wage remains at 1,500, hence why they are unable to accommodate their daily needs and expenditures. Next is poverty due to health issue. Based on the article, if the head of household HOH were to suffer from critical medical conditions such as stroke, thalassemia, diabetes, kidney failure and many other diseases that require intensive treatment, they will have trouble paying for their medical expenses due to their low income. They need to prioritize buying and providing basic necessities like foods, shelter and clothes for their family, and they had to set aside their medical expenditures. The third factor in poverty is a lack of skills and education. Based on the article, lack of skills and education will result in them having to compete for employment, especially in densely populated urban areas. According to an article written by Nur Aini and Chamhuri, the urban sector cannot provide many jobs and there is competition for profitable salary. Because nowadays, these people also have to compete with foreigners to work in informal sectors such as fishermen or lorry drivers. The last factor that causes poverty is the single mother's issue. The article also highlights the issue of poverty faced by single mothers who struggles a lot in finding a job to raise their children without a spouse, and then resulting in domestic abuse, financial instability and divorce. And as a result of that, they struggle to find a job and to have stable income as they have to accommodate the needs of their children.
Hence, in order to tackle this issue, there are few solutions, such as that the government should be strict about controlling the price of goods like oil, grain and sugar by providing a mobile counter that give out information about aid and programs implemented by the government. It can help the B40 group. Moreover, the government has to elevate the quality of healthcare services by addressing the issue of poor patients not being able to access hospital due to the economic constraint. The government can take the example of door-to-door doctor service, which is currently operated by private individual and expand it to government hospital. There are a range of programs aimed at improving the income of the poor, such as job training, micro-enterprise development, and the provision of childcare. On the job training in industrial countries like Latin America shows positive effect through intensive investment and psychological development. Last but not least, the zakat management program also one of the solutions that can be tackled the issue of poverty in urban areas. This can be seen in Majlis Ugama Islam Brunei, whereas under the Ministry of Religious Affairs, they specifically aim to help single mother with financial difficulties to survive another day by adding basic necessity and so on.
In conclusion, achieving the objective of zero poverty has been a top priority for many nations, including Malaysia. However, the B40 group has difficulties in their attempts to raise the standard of living. Therefore, in order to help the B40 group break free from the bonds of poverty and increase their income, a long-term solution that is both workable and appropriate for their circumstances should be found.